Good evening, myself, Dr. Mateen Shaikh. I am consultant pulmonologist and intensivist at Hope Hospital, Akola. So, audience, today we'll discuss in short, in brief, about the high blood pressure and how to prevent it. So, generally, everyone would like to have healthy or normal blood pressure. What exactly does it mean? High blood pressure basically each time when the heart beat, it pumps the blood into the blood vessels. This create the pressure against the wall of the blood vessels. This is called the high blood pressure. And normally in healthy person, it raise and the fall throughout the day. But when the blood pressure remains high for the longer time and left untreated, this pressure, when the normal blood pressure is, when the pressure is remains high, this is called the high blood pressure. High blood pressure usually develop over the time. It can happen because of the unhealthy lifestyles. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and the stress. There are other risk factors that can also increases the risk of developing hypertension, such as age. As the people get older, the arteries can stiffen up and narrow as excess fat buildup. Family history of high blood pressure, one or more close family member with hypertension increase the person risk of developing hypertension. Excess salt intake is also known to raise the blood pressure. Eating processed and fatty food increase the fat throughout the body and make the heart work harder to push the blood throughout the body. So moving on, hypertension does not have any obvious signs of symptoms. That's why it's called silent killer, because BP will raise gradually. That is what we have already discussed earlier. So when it raise and remains constantly high towards higher sides, it develops gradually the symptoms. So it puts the people to risk of several diseases, the cardiovascular problem, kidney failure, stroke, or even eye damage and the blindness. Hence, Hence, early and accurate diagnosis is very important to management of hypertension. So measuring the blood pressure is the only way to know whether the person having high blood pressure or not. And generally, when the symptoms do occur, they include the morning headache, tiredness, vision changes, buzzing in the ear, fatigue, nausea, vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with the instrument called the sphygmomanometer. A blood pressure is recorded in the two number systolic and the diastolic. Now let's try to understand what do these numbers actually means. A healthy or the normal blood pressure should be lower than 120 by 80 mmHg, or it can also read as 120 over 80 mmHg. Hence, the upper number indicates the systolic pressure, and which means the pressure in the blood vessels when the heart contract. Whereas the lower number indicate the diastolic blood pressure, means the pressure in the blood vessels when the heart rests between beats. If the blood pressure level is more than 140 by 90, then the person have hypertension. If the person have BP level higher than this, then he or she might at risk of developing serious heart diseases. The risk can be prevented and reduced by taking steps towards the healthier lifestyle. So that is very, very important, that how to prevent it. Prevention is better than cure. So how to prevent the hypertension? By doing regular exercise, healthy diet, quit smoking, reduce the alcohol intake, stress management, and adherence to medicine. So adherence to medicine is very, very important. Once the patient diagnosed and after taking all these precautions, adherence of medicine is very, very important. So regular exercise and physical activity. What type of exercise and the physical activity? Exercise can be drug-free approach to lower the blood pressure. It's very, very important that we can avoid the taking medications. So regular physical activities make the person heart stronger. If one have a strong and a healthy heart, it can pump more blood with less efforts. So in other cases as well as average, in other cases also, we all aware of the age and the weight gain are the two major risk factor for the high BP. So if the blood pressure is at desirable level less than 120 by 80 mmHg, then exercise can help to prevent it from rising as you age. So regular exercise, by doing regular exercise in the early stages, we can avoid drug consumptions. The second is healthy diet. So diet also important role in the controlling blood pressure. Diet with high intake of vegetable, fruits, whole grains is recommended for hypertensive patients. Other thing is that to reduce the sodium in your diet. So that is very, very simple technique and important measures that we can reduce our blood pressures without medications. So even the small reduction in the sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 mmHg if you have high blood pressure. Then quit smoking, regular blood pressure monitoring, stress management. By learning how to relax and manage the stress can improve the emotional and the physical health and lower high blood pressure. Adherence to medicine, that is what we have discussed earlier, it is very, very important. Adherence to medicine, a medicine to lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually at or above 140 by 90. Adherence to medicine is very, very important as it controls your blood pressure regularly. At least I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. So it is very much possible to maintain normal blood pressure level with regular monitoring and preventive care. Thank you.